Good afternoon, everyone. Bonjour à toutes et à tous. Une nouvelle vague de la pandémie de COVID-19 déferle sur le Nouveau-Brunswick. Nous espérions que cette situation ne se produirait pas, mais nous savions qu'elle était possible et nous sommes prêts à y faire face maintenant qu'elle est arrivée dans la province. C'est pourquoi nous agissons rapidement de manière décisive afin d'éviter que les éclosions présentement en cours se propagent de façon plus générale dans l'ensemble de la province. A new wave of the COVID-19 pandemic has arrived in New Brunswick, and we had hoped this would not happen, but we expected it might, and we are ready for it now that it is here. We are acting quickly and decisively to prevent the outbreaks now underway from spreading more broadly across the province. We have a proven track record of success against COVID-19, but now the risks are greater, and the consequences of inaction are more severe. There is a serious risk that the outbreaks now underway could spread even more widely, overwhelming our healthcare system with hundreds of new cases every day, as is now happening in Maine and Quebec. And let me just highlight the fact that we've had 50 new cases over the last 3 days. So if that were to double, that becomes 100 in a few days, that becomes 200 a few days later. And we still haven't seen the effects of the New Year's Eve gatherings in terms of a spike in cases yet. If we act decisively and urgently, with determination, we can again be a model of success in limiting the spread of COVID-19. Santé publique a recommandé au cabinet aujourd'hui que toutes les zones de santé à la province régressent à la phase d'alerte orange du plan de rétablissement du Nouveau-Brunswick. Nous prenons ces mesures pour ralentir la propagation rapide de la COVID-19 dans la province. Le nombre de cas a plus que doublé au Nouveau-Brunswick en moins d'une semaine. Il y a maintenant des cas actifs dans chaque région de la province. Et dans les derniers 3 jours, il y avait eu 50 cas nouveaux. Ça veut dire que si ça continue à doubler, on va voir 100, 200, 400. C'est très sérieux à ce moment-ci. Public Health has today recommended to Cabinet that all health zones in New Brunswick transition back to the orange alert level in our provincial recovery plan. We are taking this action now to slow the rapid spread of COVID-19 within the province. The number of cases in New Brunswick has more than doubled in less than a week. We have had more than 50 new cases in the last 3 days alone, and we now have active cases in every region of the province. And again, that does not include a spike in cases that we're expecting to see as a result of New Year's Eve gatherings. Today, there are 27 new active cases of COVID-19 in the province. This is the largest number in a single day since the beginning of the pandemic. We are also very concerned about the new variants of COVID-19 which have emerged in the United Kingdom and in South Africa. And in fact, the UK variant is already in 30 different countries, including Canada right now in 3 different provinces. And we need to take additional measures to prevent these strains from reaching New Brunswick. For these reasons, I urge everyone to avoid all non-essential travel within the province, as well as to places outside New Brunswick. New Brunswick cases of COVID-19 in New Brunswick, the new cases of COVID-19 in New Brunswick are reported today as follows. In Zone 1, which is the Moncton area in the southeastern New Brunswick, 9 new cases. Zone 2, which is the St. John, Kings, and Charlotte counties, 3 new cases. Zone 3, which is Fredericton, Central New Brunswick, 11 new cases. Zone 4, which is the Edmundston, Grand Falls region, 2 new cases. And in Zone 5, which is the Hamilton-Restigouche region, 2 new cases. There are connections with a lot of these cases in terms of close contacts in all regions as well. There are now 80 active cases of COVID-19 in the province, with 1 person in hospital in intensive care, and I ask you to keep that person in your thoughts and prayers as well as their family members. Les nouveaux cas de COVID-19 au Nouveau-Brunswick annoncés aujourd'hui se répartissent comme suit. Il y a 9 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de St. John, de Kings et de Charlotte, il y a 3 nouveaux cas. Dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, il y a 11 nouveaux cas. Il y a 2 nouveaux cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault. Il y a 2 nouveaux cas dans la zone 5, soit la région de Hamilton-Restigouche. Il y a présentement 80 cas actifs de COVID-19 dans la province, dont une personne est hospitalisée aux soins intensifs. Et s'il vous plaît, gardez-le dans vos pensées. This is not a good situation. It has the potential to get significantly worse in the days ahead. While privacy considerations do not permit me to get into specifics, there is a common thread among many of these recent case clusters which I must underline, and we have seen these in past outbreaks in zones around the province. Including in several of the clusters, people who have exhibited COVID-19 symptoms attended holiday gatherings with family and friends, and some people have gone to their workplace with symptoms. This has led to chains of infection which have spread beyond the initial events and creates the potential for more cases to emerge in the days to come. We did see a drop in testing over the course of the holidays, and we are seeing a rebound now, but we need everybody to actively get tested if they have even the mildest of symptoms of COVID-19, and we need them to stay at home if you have symptoms of COVID-19. Please do not gather with family and friends, and please do not go to work. COVID-19 presents in a number of ways, and when you contract it, you may not feel that unwell. You may be inclined to think it's just a cold and press ahead with your daily activities, a headache, fatigue, but when you do this, you put everyone around you at risk of exposure. The symptoms of COVID-19 can appear to mimic influenza or even the common cold. The most common symptoms include fever, a new cough, worsening cough, sore throat, runny nose, headache, a new onset of fatigue, diarrhea, loss of sense of taste, loss of sense of smell, and in children, you can see a delayed response of purple markings on fingers and toes. If you experience any of these symptoms, please don't take chances. Please stay home and get tested. Si vous ressentez n'importe quel de ces symptômes, ne prenez aucune de chance. Restez à la maison et faites-vous tester. Ne vous rendez pas au travail, à l'école, ni à tout autre endroit où vous pourriez entrer directement en contact avec les autres. Servez-vous de l'outil d'auto-évaluation qui se trouve sur le site web du GNB pour évaluer vos symptômes. Ne présumez pas que vous n'êtes pas entré en contact avec quelqu'un qui a contracté la COVID-19. Les gens que vous avez côtoyés pendant les fêtes vous ont peut-être dit qu'ils n'ont pas voyagé. If there is a chance that you are experiencing COVID-19 symptoms, please seek testing. It is vital now that we catch as many cases as we can, as quickly as we can, to make sure that we stop the transmission, and we cannot do that without everyone's cooperation. It may be inconvenient to follow these steps, but for something that can turn out to be just a cold and it isn't, we need to know, and you need to know, as quickly and as soon as possible. We need to know so that we can move quickly to protect your health and the health of everyone around you. If you do test positive, it is very important to be truthful with our contact tracing teams about where you have gone and who you have seen after contracting the virus. Very, very important. I am hearing from all the regional staff that they are having difficulty sometimes getting information. They are having difficulty with people being rude and upset with them. They're just doing their job. And I need you to cooperate with them and be patient and understanding with their job is very important, is to protect the population of New Brunswick. They have been working very diligently since the beginning of this pandemic, and they need your support and your help. These questions may seem intrusive, but believe me, they are absolutely necessary. The more information that we have, the faster we can get people who need to self-isolate and seek testing due to possible exposure, the better. Again, that is the only way to stop the transmission. Remember, confidentiality is the cornerstone of our practice, and your privacy will be protected to the greatest extent possible. I am aware that people are putting information on social media that really has no place there. If you want to support people with COVID-19, reaching out to them and offering them support on how you can help them self-isolate. What can you do for them while they're in this period of self-isolation? What can you do for their family members? We need compassion and kindness more so now than ever before. Our teams are focused on getting to the right people at the right time so that we can limit the spread of this disease. We will likely see more cases in the coming days as infections from New Year's parties and other recent gatherings emerge. How quickly we reverse this trend depends on each of you. We can all see what is happening elsewhere in our country and around the world as this second wave of COVID-19 pandemic intensifies. Hospitals, healthcare workers are overwhelmed. Businesses are closed. Cities, regions, and even entire countries are on full lockdown. We have had a very, very, very positive experience here in New Brunswick so far with having so many people cooperate and enjoy the benefits of that cooperation and our success. But these things are happening right now all over the world and in other parts of Canada and our neighboring country to the west of us in the U.S. They are happening right now in our neighboring provinces and states. They are happening in the United States and in parts of Europe. Personne ne veut que cette situation se produise ici. C'est pourquoi que nous prenons aujourd'hui des mesures rapides et décisives, et c'est pourquoi il est si important que nous travaillions tous ensemble dans ce combat. If everyone does their part by wearing a mask in public places, maintaining physical distancing, staying home when we don't feel well, getting tested, I am confident we can get back on track. By working together, we can move New Brunswick back into the yellow phase of recovery, hopefully sooner rather than later. En travaillant ensemble, nous permettrons au Nouveau-Brunswick de revenir à la phase d'alerte jaune du plan de rétablissement le plus vite que possible. Thank you very much. Merci.
Bonjour, good afternoon. The rising number of active COVID-19 cases in our province is indeed alarming. New Brunswick has added more than 50 new active cases in only 3 days. We do not want what has happened in other provinces and other countries to happen here in New Brunswick. We have seen how fast this can spread, how fast it can get out of control. A single index case in the St. John region before Christmas resulted in 80 positive cases. C'est pourquoi il est impératif d'agir rapidement et de manière décisive quand le nombre de cas actifs augmente très rapidement. Unfortunately, in spite of aggressive messaging prior to and during the holiday season, we knew that some would selfishly ignore the rules. Looking at the numbers, there is a risk that our healthcare system could quickly become overwhelmed. This is as we are seeing in other provinces, and thus immediate action is required. Given our current path, we could see hundreds of new active cases daily in our province. To say this would be devastating is an understatement. This morning, I met with Cabinet and the All-Party Cabinet Committee on COVID-19. We are accepting the recommendation of Public Health, and as of midnight tonight, we are moving all of New Brunswick to the orange alert level. Nous acceptons la recommandation de la santé publique et à partir de minuit de ce soir, toutes les régions de New Brunswick passeront à la phase orange. Nous avons pris cette décision parce que les risques et les pressions sur notre système de santé augmentent dans toutes les régions de la province. Ces virus représentent un risque réel et il est partout autour de nous. Yesterday alone, Quebec had 2,546 new cases of COVID-19, while Maine had 376 new cases. To combat COVID-19, Quebec and Ontario are enforcing strict rules. Ontario went into a province-wide shutdown at 12:01 a.m. on Boxing Day. Residents are being asked to stay at home as much as possible and to limit trips outside of the home to necessities. In Quebec, partial lockdown measures were imposed, and it is being reported that restrictions could increase to include a curfew. Si nous ne sommes pas prudents, c'est dans cette direction que le Nouveau-Brunswick va se diriger. Tout le monde doit limiter ses contacts à sa bulle formée d'un seul ménage. Cela comprend les gens avec qui vous habitez. Et vous pouvez aussi ajouter un aidant ou une autre personne qui a besoin de soutien. Please do not travel outside of your zone except for essential reasons such as work, school, essential errands, and medical appointments. We typically have 4,000 to 5,000 people in self-isolation for travel. Yesterday, we had 6,430 people in our province self-isolating due to travel over the holidays. It was up as high as 8,000. So during the holiday period, we certainly have seen increased travel, which necessitated increased isolation. I want to remind these people that they must complete the full 14-day self-isolation period. Nous rappelons à toutes les personnes qui arrivent dans notre province qu'elles doivent respecter les règles concernant l'auto-isolement. Ces règles leur ont été données lorsqu'elles ont enregistré leur voyage pour venir au Nouveau-Brunswick. We will be increasing our health and safety checks on self-isolating travelers. Officers will also continue making in-person visits. L'augmentation du nombre de cas actifs est attribuable en partie au réservement de temps des fêtes et aux personnes qui ont participé à ces réservements alors qu'elles présentaient déjà des symptômes de la COVID-19. For example, a poker game in rural New Brunswick has resulted in multiple cases. As well, people who are symptomatic have also been going to work. For example, one person exposed up to 150 others. Some have lied to public health contact tracers, slowing down and reducing the effectiveness of contact tracing and putting others at risk. If you don't care about yourself, please care about others. We have done so well to date. Vaccines are on our radar. They are coming to our province. We've already vaccinated people. Let's not lose sight or lose hope at this point. We are indeed talking life and death at this time. If you have symptoms, self-isolate. Don't take it for granted. It's just a cold. It's just a sniffle. Get tested and be honest with public health. There is no shame in getting COVID-19, but there is shame in lying to someone or avoiding their truth or avoiding their reality and someone paying the ultimate price and dying because of it. By knowingly putting others at risk to save yourself embarrassment is not acceptable. And it's not embarrassing to get COVID, but it can be life-threatening if you don't tell someone about it or get yourself tested. We are seeing the reality of COVID-19 every day through its impact across Canada and around the world. On top of the steps we are taking to protect New Brunswickers, we are also pushing the federal government to provide more COVID-19 vaccines to our province. We are ready to receive these vaccines and are prepared to administer them as soon as they arrive. We have the capability of vaccinating up to 45,000 people in a week as a minimum. To date, New Brunswick has received only 850 doses of vaccine, with another 6,500 coming next week. But on the current level of vaccines that will be deployed to our province, we will not be able to vaccinate our population to herd immunity until midsummer, late spring, midsummer. We can do it so much faster. We, in fact, could ultimately do it in 10 weeks, but we need vaccines to do that. Les gens doivent comprendre qu'en raison de l'approvisionnement actuel, nous aurons besoin d'une grande partie de l'année pour administrer le vaccin à toute la population de Nouveau-Brunswick. It's also important we do what we can to support and protect the small businesses across the province who have been impacted by the pandemic, particularly as we have moved in and out of Zone Orange. Today, we are pleased to announce additional relief for small businesses impacted by COVID-19 in the form of a non-repayable grant. Il est essentiel de continuer à soutenir les entreprises qui font face à des problèmes, en particulier quand elles sont touchées par des mesures de santé publique plus restrictives mais nécessaires dans la phase orange ou rouge. Through Opportunities New Brunswick, these grants of up to $5,000 will be available for small businesses that have been subject to the orange or red alert level measures for at least 1 week between October 10th, 2020 and March 31st, 2021. Further details such as how and where to apply and eligibility will be available in the near future. This new support is in addition to the enhancements being made to the Small Business Emergency Working Capital Program. Thanks to that program, as of December 11th, more than $17 million has been distributed throughout the province, with an almost 50-50 split between northern and southern regions. J'invite encore fois les gens de Nouveau-Brunswick à continuer d'encourager les entreprises de leur communauté et de soutenir leur économie locale. Il y a de la lumière au bout du tunnel, mais le coronavirus est encore présent au Nouveau-Brunswick. As we embark on this new year, let's resolve to continue to work together, to keep one another healthy and safe, so that when the time comes, we're all here to celebrate together. And let's hope that 2021 will indeed be the end of COVID. And it'll be the end of COVID for all of us that are living in this province right now, not for only some, because we've lost others because we've got careless. We have to continue our diligence. We have to persevere. The vaccine is here, but not in the quantities to allow us to vaccinate our population as needed. But it will be, and we need to be patient. We need to ensure we protect one another. Thank you. Merci.
Prompt team is back on site today and will go through with all that testing. And all the residents of Tucker Hall are currently isolating in their suites, and retesting of all the residents' employees of Tucker Hall will take place today.
Thank you, Doctor. Thank you, Mr. Fortman. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, can you elaborate a little bit on the rollout of the Moderna vaccine this week? How are the 20 long-term care homes receiving the vaccine selected? And are there any long-term care homes where nearly all of the residents will have been vaccinated once the second dose is administered?
I guess all I can say in terms of the details of the rollout is that the planning sessions have happened over quite a number of weeks, and today they are doing clinics today and tomorrow on for 20 long-term care facility residents all around the province. So and as of right now, we have administered 2,905 doses, and by next Monday, we expect to administer another 4,500 vaccinations, and that includes more than 1,800 second doses. So to date, we've received 8,250 doses of the vaccine. So I don't really have any more details on that right now, but I can get back to you on that.
Thank you, Ms. Hogarth. Natalie Sturgeon, Brunswick News.
Thanks, Bruce. My question is for Dr. Russell. Given that Tucker Hall is now facing another outbreak, even before the last one could be declared over, and we've learned from the company that the worker who had tested positive worked there as late as January 2nd, what is public health's plan to deal with the reintroduction of the virus from outside the nursing home, given the situation we're dealing with right now?
Well, obviously, when any long-term care facility or adult residential facility or nursing home is involved in an outbreak, we're obviously very concerned, but our processes remain the same, whether it's a new outbreak or whether it's an outbreak that is a new outbreak in a setting that has already had outbreaks. So there's no difference in our approach moving forward. It's unfortunate to have a long-term care facility be affected more than once, but it's not out of the realm of possibilities anywhere in the province, including the outbreaks that have happened in other places all around the province. That's why these settings are considered vulnerable, and that's why those are the settings where we are targeting our vaccination rollout for those populations for that very reason.
Thank you, Ms. Sturgeon. Laura Brown, CTV.
Hi there. I'm wondering if there is a case that's been confirmed at the People's Park Tower in Moncton, and if that's a situation you're looking into as a potential outbreak.
My understanding is the Regional Medical Officer of Health for Moncton has communicated with that establishment, and that's all I know at this time.
Thank you, Ms. Brown. Gilles Duval, TVA. Gilles Duval.
Oh, bonjour.
Bonjour, Gilles.
Ah, OK, d'accord. Écoutez, en constatant le nombre de cas qui sont en hausse, si on avait demandé aux gens de faire attention durant le temps des fêtes, est-ce que vous savez si, par exemple, il y a eu des rassemblements illégaux, soit des amendes, des contraventions qui ont été données, ou il n'y a rien en ce genre-là qui a été rapporté?
Il n'y a rien officiel sur les gens qui ont fait des choses qu'ils n'étaient pas supposés de faire, sauf qu'on voit des cas en résultat des rassemblements. Je crois pour la plupart des gens du Brunswick qui ont suivi les directives de santé publique, le problème, c'est que même un tout petit nombre de personnes, s'ils font des choix qui ont impacté des gens à des rassemblements et à leur place à l'emploi, ça veut dire qu'un grand nombre de personnes sont en auto-isolement maintenant à cause de ces décisions et ces choix de certains individus. Et l'impact est vraiment sérieux et sévère à ce moment-ci, et c'est la raison qu'il faut aller à la phase orange tout alentour du province à ce moment-ci.
Merci, M. Duval. Marie Sutherland,
Merci.
CBC.
Hi, my question is for Dr. Russell. Horizon CEO Karen McGrath sent a memo advising all Horizon staff and physicians that public health is investigating.
Marie?
Yes?
Oh, you just cut out.
You cut out.
Oh, sorry. Okay, I'll just start over.
Yes,
Yep,
please.
please.
Okay. This is for Dr. Russell, though perhaps it may be for Premier Higgs. I'll leave it up to you. So Horizon CEO Karen McGrath sent out a memo advising all Horizon staff and physicians that public health is investigating 3 confirmed cases in the Upper Valley region. Can you confirm whether these cases are healthcare workers or not, and at which hospitals or facilities, and whether this has impacted operations at the hospital or?
So thanks for the question. What I have is 60 healthcare employees are off work due to COVID-related reasons around the province. So 49 Horizon employees, 9 Vitalité employees, and 4 extramural and ambulance New Brunswick employees. 16 non-urgent surgeries have had to be canceled over the past few days at Upper River Valley Hospital. I am very concerned about the number of healthcare workers impacted right now. And what also concerns me is the fact that we are still continuing to see a rise in the number of cases, and we expect to see more as a result of gatherings over New Year's Eve. So with that in mind, the number of 60 is what we have right now who are impacted. I do expect that number to increase, and that is very, very concerning at this time.
Thank you, Ms. Sutherland. Thank you, Doctor. Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. C'est au sujet de l'annonce de Maritime Bus qui, dès le 15 janvier, élimine ses trajets jusqu'à Edmundston et jusqu'à Hamilton. Maritime Bus dit qu'il est obligé de faire ça parce que la province a refusé de subventionner ses activités. Monsieur Higgs, vous avez déjà parlé de l'importance à l'avenir de peut-être voyager un peu plus loin pour obtenir des services de santé plus rapidement et de façon plus efficace. Pourquoi ne pas assurer le maintien des services d'autobus dans ce cas-là?
So I understand with Maritime Bus that there certainly was a grant to the company back in March. I think at like $160,000, and so it seems that the financial situation was strained even prior to COVID. You know, we will look at certainly health transfer capabilities or movement so that we can get everyone the services they need. But we need to understand, particularly from that company in relation to, was it a COVID-related situation, which obviously we've agreed that we would be working with municipalities to deal with, or not. And it's my understanding that an application has been made, and it wasn't COVID-related as such. And so it does fall into a different category, unlike what is required by the federal support and the matching provincial support due to COVID concerns.
Merci, Monsieur Wacomo. Thank you, Premier. Derek Haggett, Times and Transcript.
Hi, this question is for Dr. Russell. I know one of, I believe it was Laura Brown from CTV asked about the case of People Park Tower in Moncton, but the operations manager there told me public health indicated to him the investigation was complete and no other resident or employee has been indicated as a close contact. There's 400 people there plus staff. Will more people be tested? How do we know that this person hasn't had any contact with staff or other residents?
I don't have specific details on that. All I can say is that when public health does their investigation, they do a full risk assessment, and they would look at, you know, cases and close contacts based on the time of exposure, during whether or not they were contagious or not, et cetera. So in a general sense, whatever has been communicated, I don't have the information that was communicated with that facility. So all I can tell you is that throughout the pandemic, process has been the same. Public health always provides the pertinent information to the public when there's public exposure, but when it's directly with an institution, they communicate directly with that institution, they do their risk assessment, and any individuals that are close contacts are told to self-isolate. If some of them actually are tested on day 10, they're offered that day 10 testing if they've been exposed, but again, it's all based on the risk assessment that the public health team does in those types of situations. So that's really what they're following. So I can't comment further other than anybody in the entire province who has symptoms should call 811 or should go online and do the online referral and get tested. We have capacity, and we encourage everybody who has symptoms to get tested, or if you think that you have come into contact with somebody with COVID-19, definitely self-monitor.
Thank you, Mr. Haggett. Inda NTR, Huddle Today.
Thank you, Bruce. This question is for Dr. Russell. Is there any indication that with the numbers of cases just arising, could this lead to more restrictions on businesses even under orange level, or is there an indication that we could go back to red?
Well, certainly the conversations we have had up until this point have really been reflective of the new risks that we're looking at. So the new risks that we're looking at are the fact that we have the highest number of cases in any one day in New Brunswick from the start of the pandemic, number one. We are considering and factoring in the risk of the UK variant being quite a danger to our continued success in managing outbreaks and containing COVID-19 in the future. And the fact that we are introducing our immunization campaign at this very critical juncture, and again with those highest priority groups targeted for that first 3-month rollout, we really wouldn't want the healthcare system to be impacted by that. We wouldn't want the public health part of the system impacted by that, because it would impact the rollout of the vaccine program. So we have a lot of different variables that we're taking into account now when we're having these discussions, and it is a rapidly evolving situation. So if there is any new information or decisions that we're going to be making in the next few days, we will continue to have ongoing conversations, again, with our public health teams, with our partners, and with COVID-19 cabinet.
Thank you, Ms. NTR. Jim Dunville, River Valley Sun.
Thank you. This should be for Premier Higgs. I'm just wondering why the reluctance to provide COVID case information by county rather than the 5 large zones, which really give little information of where the outbreaks are.
Hi, I'm going to take that question. This question has been asked previously throughout the pandemic, and our reply has always been the same, and it has to be the same, and that is, we never know when cases are going to appear. So a case that has appeared on our radar, on our dashboard, et cetera, that we're reporting to the public, that is as a result of exposure that would have taken place sometimes over a week prior. So it's, once we announce a case, it's already been in a zone or an area or a community for at least a week in terms of where they would have contracted it. We know that cases can occur at any time, anywhere in the province by community transmission from travel from other areas. We know that in Nova Scotia, they had cases of community transmission for several weeks that could have made their way to New Brunswick prior to Christmas. And then, again, international travelers and domestic travelers who come into the province. I think the Premier mentioned that, we normally have between 4,000 and 5,000 travelers who are self-isolating at any one time. That increased with Christmas travel up to as high as 8,000 people. If any one of those people does not self-isolate properly, then there is a risk to their household members, et cetera. But at all times, everyone in the entire province, the entire population has to act as if COVID is in their community. They have to act as if the people that they're interacting with could be asymptomatic and have COVID-19. And if we were to dig down, there's three problems actually. One, you would have a problem with confidentiality. This is a very small province. We have lots of relatives and friends and connections in our communities that spread quite widely. So we wouldn't want to put anybody in the position of having ostracization and stigmatization occur, which we know is happening despite the fact that we are keeping things as confidential as possible. So we wouldn't want anybody to feel even more targeted and ostracized in social media, et cetera. So we don't want anybody to have a false sense of security. We don't want anybody to act as if COVID is not in their community just because there's no cases being reported there at the moment. Again, once you have a case reported, it could have been an exposure that happened, again, up to 14 days prior. So that means that it's already been circulating in the community amongst close contacts for that time period.
Thank you, Mr. Dunville. Andrew Watt, Brunswick News.
Yeah, hi, my question's for the Premier. Premier, can you offer your thoughts on Minister Holland's trip to Nova Scotia? Tell me whether or not he's going to be disciplined. And can you please give a clear definition of what essential travel is? Because, here today you're announcing no essential travel in or outside the province, but I think there might be a lot of confusion about what constitutes essential travel.
We're announcing no non-essential travel in and out of the province, and yeah, and I think it's a good point. It's been recommended, and I know that people, we see the number of people that have traveled, the number of people that are in isolation right now that did travel, even though, we did recommend, and Minister Arnold would be one of them, even though, the rules were we recommend not to travel. But it was a recommendation, and if you did travel, you had to follow all of the isolation procedures, which many we believe have done, some have not, which is why we're in the situation we're in. Minister Holland did follow all the protocol requirements, and he's been in isolation since he returned. But the point is, we are reinforcing that, and there is a list, and in fact, to your very question, the discussion this morning went around some of the ambiguity in relation to, people can sometimes make their own definition of essential. So we're going to further define that in the coming days, and so that we'll have a better definition, let's say by Thursday of this week, to bring clarity of what we expect people to do and not do, who can travel and who can't travel, and be more precise. Because I appreciate there's a vagueness there that has allowed flexibility when, if people all isolated in taking advantage of the recommendation versus the order, then that would be one thing. But it's apparent that they haven't. Equally, the challenge is that it's almost unenforceable. And so even though we recommend someone that if we say you cannot travel, how do we enforce it? And it comes down to the age-old problem that we've had from the beginning, is that we expect people to do the right thing. We encourage them to do the right thing, to isolate when there's any doubt of any kind. And if they don't do that, they're exposing themselves and others. And that's what we're continuing to expect, but bringing greater definition will be our target for this very week.
Thank you, Mr. Watt. Isabel LaRose, Radio Canada.
Hang on 1 second, please. Sorry. Is Minister Holland going to be disciplined or not?
No, Andrew, I don't intend to take it any further. Not that, we looked at traveling abroad, and there were some big issues, people that traveled outside of the country and outside of even Atlantic Canada. We were in a bubble and I'm not condoning it in any way. I'm just saying that, no, I don't intend to pursue it any further, but I certainly do intend that he will stay in isolation.
Thank you. Isabella Rose, Radio Canada.
Oui, bonjour. Ma question est pour le Premier ministre Blaine Higgs. Du côté du Québec, la communauté frontalière de l'Isti-Gauche, la communauté Mi'kmaq, compte actuellement 13 cas actifs. Est-ce que vous comptez resserrer les mesures aux frontières du côté de Campbellton, sachant que les gens de l'Isti-Gauche et de Pointe-à-la-Croix ont toujours l'autorisation de traverser 2 fois par semaine pour des besoins considérés essentiels?
The short answer is yes. We have been, working in, certainly in the border communities, and I emphasized some numbers here today in showing what the case count's been, not only in Quebec, but in Maine. So we will be increasing our diligence at the border. And when we know people are coming for an essential service, we want to continue to allow that ability for people to travel for their needs, essential needs. And that includes certainly in the communities in the north. But the idea has to be that people are prudent with their behavior. In other words, you don't come 5 or 6 times during the day for essential service that you could have accomplished in one trip. And we will be watching for that very closely and likely certainly tracking individuals to ensure that they are compliant, because this is no joke. And we're not going to take it lightly that we're in this situation so close to the finish line.
Merci, Monsieur le Premier ministre. Merci, Mademoiselle Larose. Savannah Odd, Telegraph Journal.
Hi there. My question, I guess, could be for either Dr. Russell or the Premier. I'm wondering when both of you will receive the COVID vaccine and when Cabinet will receive the vaccine as well, if there will be any priority in the vaccine rollout.
So far, we haven't made the priority list. Healthcare workers do, so Dr. Russell would be there ahead of myself, and she volunteered to vaccinate me. Now, she said she hadn't done it well, so I'll get her to practice on maybe a few other people first. But we aren't on the priority where there will be others. Certainly, the priority list is well defined. We will be monitoring certainly our behavior to stay safe and keep others safe, as we have been from the very beginning. But with the limited number of vaccines that are currently available, we're going to put them where the most vulnerable are, and that's the front lines and with healthcare workers and seniors that are in the vulnerable situations. That'll be our focus, and as vaccines become more prevalent, then certainly we'll look at being vaccinated ourselves, but I will do it at any time.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, this spiking cases started over the weekend, and some regions were rolled back to the orange level much sooner, or when their numbers were much lower. Can you please explain why did you wait until now to make these changes?
Context. So every single zone that has had outbreaks, we've had the same risk assessments done with the same conversations around triggers, hospital capacity, healthcare workers impacted, public health compliance, the rapidity with which we can do contact tracing and testing, as well as the type of transmission that we see, and the number of cases in terms of increasing. In some settings, there were very early on very vulnerable settings that were involved. So any of the outbreaks that involved hospital care workers, any of the outbreaks that involved long-term care facilities, et cetera, those vulnerable settings would have increased our considerations of all the triggers for that zone and that outbreak. So it was a very different picture. Over the course of the last couple of days, the picture has been changing very rapidly with the rapid rise in cases across the province, mostly in Zone 1 and Zone 3, but all areas of the province are being touched by this. Close contacts are spread out all over the province right now. We did have a lull in testing over the holiday period, and we are trying to rebound from that now in terms of getting an accurate picture of what's been taking place. We do need the cooperation of the public right now to get tested, even with very mild symptoms, because the driving force of these outbreaks right now have been situations where people had mild symptoms and did not self-isolate and did not get tested and attended gatherings with family and friends, and also attended workplace settings.
Thank you, Ms. McKinnon. Erica Butler, CHMA, Sackville.
Hi there. This is for Dr. Russell. You mentioned to me yesterday that there were 2 clusters in Zone 1. I guess I'm just looking for an update on those. Have the sources been traced, and are those both recently identified clusters, or do they date back to around Christmas time?
So up until the last few days, all of the clusters, in fact, there were 3 clusters. There are probably more clusters now, but my information as of yesterday afternoon was that there were 3 clusters, 2 in Zone 1 and 1 in Zone 3, mostly related to gatherings around the Christmas time period, also some workplace exposures. So now moving forward in the last couple of days, we are seeing a rapid number of cases. Perhaps some of them are close contacts of cases that we're self-isolating at home, and we're, watching and waiting to see if they would become positive on. Some of them were given the day 10 test while they were self-isolating if they were asymptomatic, and if they had symptoms, obviously they got tested right away. But what is also of concern is that we haven't seen the spike in a number of cases related to New Year's Eve gatherings. So that compounded with the number of cases we're seeing right now does not bode well for the immediate future in terms of how we're managing. So that is why we do need to have the whole entire province in the orange phase right now to deal with the existing outbreaks and clusters, as well as what we're anticipating to see over the next 3 to 4 days with more clusters and more cases from New Year's Eve gatherings.
Thank you, Ms. Butler. David Koch, Times and Transcript.
Yes, thank you. The question is for Premier Higgs. Premier, we're hearing more reports of sharp rent increases from tenants in Moncton. I spoke to one couple yesterday, both of them 60 years old, who recently received notice of a rent increase of 33%, and they said they'll also be responsible for utilities. And altogether, they believe it'll be an increase of more than 50%, which they say they can't afford, and they don't know what they're going to do amid the affordable housing crisis in Moncton. And as you know, there have been calls for rent control, and on December 3rd, you said the government wanted a better understanding of the situation before taking action. Have you come to any decision about rent control, and do you have any message for renters like these facing steep increases?
So I don't have any further, plan at this stage to put on rent control. I have asked, and I have not received a report at this point in relation to how widespread this issue is around the province, how significant. And as I said before, it's kind of how we balance the fact that many cases we want landlords to upgrade their facilities and invest in them. I know we're seeing a spike in real estate values, and that is playing a role here. So I'm still waiting, hoping to get this early in the next few weeks. An indication of just how widespread it is, and if these rent increases are reasonable. The other factors that go into play is looking at how long have rents been either dormant, or have they been decreasing, or is this a spike that's been going on for a little while? Because we saw quite a period of time there when rents were not moving at all, vacancies were very high. And so I do want to understand the whole process. Is this a trend we would expect would continue? Because that'll be problematic. Is it a case the rent is fair and reasonable now and it was low before? It's more than just an absolute rent increase by itself. It's understanding the big picture, where it's going. And we need to understand from landlords exactly what their intentions are.
Thank you, Premier. Thank you, Mr. Koch. Adil Ibrahim, CBC.
Yes, thank you. This question is for Dr. Russell. We've heard reports that members of the military were allowed to travel to hot zones such as Quebec and Ontario for the holidays. What can you tell us about that?
Sorry, I missed the first part of the question, sorry.
We heard reports that members of the military were allowed to travel to hot zones like Quebec and Ontario for the holidays. So what can you tell us about that?
I don't have any information on members of the Canadian Armed Forces at this time, so I can't comment on that.
Thank you, Ms.
Okay.
Ibrahim.
Also, just to clarify one thing, I just wanted to clarify whether this lull in testing you mentioned earlier was due to reduced hours and staffing shortage, or if people were just not requesting tests.
No, it was a result of people not requesting tests. So that's why we're encouraging people right now, if you have symptoms, please go get tested. Again, perhaps it would have been, some of the outbreaks would have been prevented if people had gotten tested, but we certainly did not have a problem with access and capacity at all during the holiday season.
Thank you, Ms. Ibrahim. Simon Delattre, l'Acadie Nouvelle.
Oui, bonjour. Une question pour la docteure Russell au sujet de la campagne de vaccination. J'aimerais, en fait, c'est deux questions en une finalement. J'aimerais savoir quelle est la capacité de vaccination de la province actuellement et également qu'est-ce qui reste à définir en termes de population prioritaire pour la vaccination.
Alors,
au niveau des âges et des conditions de santé.
Ça, c'est plusieurs questions, vous savez. Mais je vais les adresser. Alors, pour les vaccins, si on avait le nombre total qu'on avait besoin pour vacciner la province, on pourrait le faire d'ici à 10 semaines. Le problème, c'est qu'on n'a pas le choix au sujet de le nombre de doses qu'on va recevoir, soit de Pfizer ou de Moderna dans les 2 prochains mois, peut-être même les 3 prochains mois. Alors, pour le premier étage, ça déroule très bien à ce moment-ci. On va continuer à recevoir des doses de Moderna et Pfizer pour les groupes de priorité. Et comme les autres provinces, la priorité, c'était vraiment décidé au niveau national avec la comité d'immunisation nationale. Alors, c'est les résidents des foyers de soins, des résidences à long terme et résidences pour les adultes, aussi les travailleurs de santé, les plus âgés et aussi des adultes, des membres de communautés autochtones. Alors, ça, c'est les premiers groupes de priorité, mais on a des très les nombres de doses sont très bas à ce moment-ci. On n'a pas de contrôle sur ça. Alors, fur et à mesure qu'on reçoit les doses, on les donne. Ça va bien. Le déroulement, c'est très bien planifié. Et alors, ça veut dire que pour les groupes de priorité, la manière que ça déroule, c'est qu'ils vont être contactés par la santé publique. Mais la deuxième étage, il y aura un autre groupe de priorité avec des endroits comme des prisons et aussi des places où les gens homeless shelters en français. Sans-abri. Merci. Les travailleurs de santé aussi, comme les pharmacistes et plusieurs d'autres sortes de travailleurs essentiels, comme les gens qui travaillent pour maintenir les structures critiques dans les parties du province. Alors, la deuxième phase, après que ça c'est fini, ça veut dire que la troisième phase, ça va être en même temps qu'on va recevoir le plus nombreux doses dans le déroulement de les cliniques d'immunisation. Alors, il y a 7 vaccins qui, on espère, qui vont être acceptés par Santé Canada. Et les derniers vaccins vont être distribués en grand nombre. Alors, ça serait plus accessible pour les membres du public, les gens qui ne font pas partie des groupes de priorité, les gens qui n'ont pas des maladies chroniques, etc., les gens qui sont en bonne santé, qui sont âge 55 ou en dessous. Alors, la majorité des doses vont arriver pour la majorité de la population environ le mois de juin à septembre. Alors, ça, c'est la campagne le plus grand en termes de les nombres de personnes qu'on veut vacciner. On sait qu'environ 75% de la population du Nouveau-Brunswick veut avoir le vaccin. Nous, on serait heureux, content si on va voir entre 60 et 70% de la population recevoir le vaccin d'ici au mois de septembre. Mais certainement, s'il y a plusieurs personnes qui le veulent, on espère d'avoir un grand nombre de doses pour leur donner. Si on recevrait plus de doses en avance de ce qui est déjà planifié. Fur et à mesure qu'on le reçoit, on peut le donner.
Merci, docteur. Merci, monsieur Delatte. Rose Saint-Pierre, Radio-Canada.
Merci, Bruce. Oui, question est pour Dr. Russell. Vous avez dit que la pression était forte sur le système de santé en ce moment. Est-ce que vous pouvez nous dresser le portrait de la situation pour les hôpitaux et les foyers de soins? À quoi ça ressemble en ce moment?
Alors, il y a les différentes situations avec les hôpitaux au niveau de la capacité pour les services comme tels, pour les staffs et s'ils sont impliqués en face de la COVID-19 qui vont besoin de rester à la maison en auto-isolement. Alors, c'est les services comme tels et aussi le nombre de lits et les nombres de lits dans les soins intensifs. Alors, qu'est-ce qui arrive quand on a plusieurs cas de COVID? On sait qu'il y a un pourcentage qui vont falloir être admis à l'hôpital. Ça, c'est un défi si on est déjà rendu à capacité. C'est un défi s'il y a plusieurs travailleurs de santé qui sont impliqués et si les situations avec les gens et les services qu'on veut offrir pour les maladies non COVID vont être compromis. Alors, c'est une situation de balance. À ce moment-ci, on a des discussions chaque jour avec les réseaux pour déterminer la capacité dans chaque hôpital basée sur toutes les mesures que je vous juste vous donner. Alors, c'est quelque chose qui peut changer très vite avec les nombres de cas qui augmentent très vite.
Merci, Mademoiselle Saint-Pierre. Tom Bateman, Brunswick News.
Oh, hi there. I realize I'm asking this question with, the benefit of some hindsight, but I wonder if Dr. Russell and your colleagues, if you contemplated this dramatic increase in cases for the holiday season when you were kind of designing the measures that you'd advise the Brunswickers to follow. I mean, did you anticipate the 50 cases in 3 days, multiple clusters and that sort of thing, when you decided on how to advise us through the holidays? Thank you.
So I don't have a crystal ball, so at no time during the pandemic could I ever guarantee anything other than that there are no guarantees. That's the simple answer. However, knowing what we know now, I mean, the introduction of the UK variant in terms of its significance around the world, being in 30 countries right now, including Canada, that has thrown a wrench into our planning and our ideas around what is safe for the population as a whole. So our discussions around that have evolved since that information has been available. The other new information that we have to continue informing our decisions are around, again, the increasing number of cases globally within Canada as well as in the U.S. And the number of travelers that could introduce those risks to New Brunswickers who haven't traveled. So we were, even prior to Christmas, looking at ways of tightening things up so that we're minimizing the risks, understanding that if you have the visual concept of the pieces of Swiss cheese and the holes all lined up, that there's no one thing that was going to protect us, aiming for a number in terms of close contacts around gatherings. We knew that the risks were going to be greater. We were hopeful that we would be able to escape any scathing and untoward effects of the travel combined with the gatherings, but we knew that the risks were there. And the problem with COVID-19 is once the cases start, they can increase exponentially at a very rapid rate. And so taking action very swiftly and decisively, very early, has been the thing that has helped us throughout the pandemic. We do hope that it helps at this time, knowing that we do have another spike in cases that we expect to see over the weekend as a result of New Year's Eve gatherings. But we have a strong team and we have strong commitment from everyone to work hard at getting this under control and containing it as soon as possible. And I do encourage everyone to, again, rededicate and recommit to this approach in terms of resetting what we need to keep as a priority based on the fact that we do not want our immunization program to be impacted. We don't want our healthcare system to be impacted. We know there is a risk of the UK variant being introduced that will increase the complexity by a large amount. And again, we've been working hard for the last 9 months. Now is not the time to lose that momentum. So we all need to dig deep, go hard, and work together to get through this.
Thank you, Mr. Bateman. Thank you, Dr. Michael Tutton, Canadian Press.
Dr. Russell or the Premier, you've mentioned your healthcare system could be overwhelmed. If this continues, and Dr. Russell seems to be suggesting it will for a little while, and you move into the hundreds, how long before your system is overwhelmed?
Well, the issue is that we're taking swift and decisive action today so that that doesn't happen. We know it could happen, and we don't want it to happen, and so that's why we're acting now to put these measures in place. But certainly, everything that can be done will be done to slow the spread at this point in time. And again, it's an evolving situation. It's a rapidly evolving situation, so we will continue meeting with our public health teams and our partners, as well as the COVID-19 cabinet.
Thank you, Doctor. Thank you, Mr. Tutton.
Did you want to add anything, Premier?
That concludes today's COVID-19 update for New Brunswick. And just for a recap, there were 27 new cases of COVID-19
That concludes today's
in the province today. 9 of those cases were in the Moncton area, 11 were in the Fredericton area. There are 3 new cases in the St. John area, 2 in Edmundston and 2 in Campbellton. And as we heard from Dr. Russell, that means the whole province, all health zones are rolling back to the orange level of recovery tonight at midnight, and a lot of that will be, obviously I know a lot of the cases were in the Fredericton and Moncton region, but there are some cases that are tied, and for preventative measures we will all be rolling back to orange at midnight. And I look forward to joining you again at the next update. I'm Vicki Hogarth. We'll see you next time at the COVID-19 update.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.